Today we're debunking some of the biggest myths about diabetes that many people still believe. Let's get right into it and uncover the truth. Myth number 1. Only overweight people get diabetes. Fact: while being overweight can increase the risk of developing type 2 diabetes, it doesn't mean only overweight people get it. In fact, diabetes affects people of all body types. Type 1 diabetes, for example, is an autoimmune disease that isn't linked to weight at all. Even with type 2 diabetes, genetics and other factors like age, activity level, and diet play a significant role. So, thin or fit, people can still be diagnosed with diabetes. It's not solely about weight, but a combination of different factors. Myth number 2. Diabetes is caused by eating too much sugar. Fact: this is a very common misconception. Eating sugar alone does not cause diabetes. Diabetes is influenced by a combination of factors, including genetics, lifestyle, and overall diet. Consuming too much sugar can lead to weight gain, which is a risk factor for type 2 diabetes. But sugar itself is not the direct cause. People with diabetes do need to manage their carbohydrate and sugar intake, but the condition's root cause is far more complex than just eating sweets. Myth number 3. People with diabetes can't eat carbohydrates. Fact: people with diabetes can absolutely eat carbohydrates. The key is moderation and choosing the right types of carbs. Healthy, whole grain carbohydrates can be a part of a balanced diet. What's important is managing portion sizes and avoiding highly processed carbs that can spike blood sugar. Monitoring blood sugar levels after meals can also help people with diabetes understand how different carbs affect them. So, it's less about eliminating carbs altogether and
Oísele.
more about making smart choices. Myth number 4. Insulin is a cure for diabetes. Fact: insulin is an essential treatment for managing diabetes, especially for those with type 1 diabetes. But it is not a cure. Insulin helps regulate blood sugar levels, which is crucial for preventing dangerous complications. However, diabetes is a chronic condition that requires ongoing management. In addition to insulin, people need to monitor their diet, stay active, and may need other medications to help control their blood sugar. Insulin allows people to live healthier lives, but the underlying condition still requires lifelong management. Myth number 5. Diabetes is not serious. Fact: diabetes is very serious and can lead to major health issues if not properly managed. People who don't control their blood sugar levels are at risk of complications like heart disease, kidney failure, nerve damage, and even blindness. It's important to understand that diabetes is a chronic condition that requires daily attention and care. With proper management, people with diabetes can live long, healthy lives, but ignoring it or not taking it seriously can result in life-threatening complications. Myth number 6. Once you have diabetes, you can't go back to normal. Fact: while it's true that diabetes is a lifelong condition, it doesn't mean that managing your blood sugar or returning to a normal state is impossible. Many people, especially those with type 2 diabetes, can significantly improve their blood sugar levels through lifestyle changes, sometimes achieving what's called remission. This means that with proper diet, regular exercise, weight loss, and sometimes medication, blood sugar can remain in the normal range without the need for additional medication. However, this doesn't mean diabetes is cured. Remission requires ongoing effort and monitoring to prevent blood sugar levels from rising again. For those with type 1 diabetes, insulin therapy is still necessary for life, but maintaining normal blood sugar through careful management can help prevent complications and improve quality of life. Whether it's remission in type 2 or careful management in type 1, living a normal life with diabetes is very achievable with the right approach. Myth number 7. You can tell if someone has diabetes by their appearance. Fact. This is a common misconception, but it's simply not true. You can't tell if someone has diabetes just by looking at them. Many people with diabetes, especially in the early stages, appear perfectly healthy. Type 2 diabetes, in particular, can develop slowly, with symptoms like fatigue, frequent urination, or increased thirst going unnoticed for months or even years. Some people may even be diagnosed during routine checkups with no visible signs at all. Type 1 diabetes can also occur suddenly and isn't always accompanied by weight changes or obvious symptoms until a medical emergency occurs, such as diabetic ketoacidosis. Gestational diabetes affects pregnant women, and they often show no symptoms until they're tested during pregnancy. The bottom line is that diabetes doesn't have a specific look, and the assumption that someone's health status can be judged based on appearance is not only wrong, but also harmful. This is why regular screening and awareness of risk factors are so important, regardless of how someone looks on the outside. Myth number 8. All diabetes is the same. Fact. Diabetes comes in different forms, and each type has its own unique causes, treatments, and challenges. The two main types are type 1 and type 2 diabetes, but there's also gestational diabetes and other less common forms. Type 1 diabetes is an autoimmune condition in which the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, people with type 1 diabetes must take insulin for life. This type typically occurs in childhood or adolescence, though it can develop later in life. Type 2 diabetes, on the other hand, occurs when the body becomes resistant to insulin or doesn't produce enough of it. This form is more common in adults, but increasing numbers of younger people are developing type 2 diabetes due to lifestyle factors like poor diet and lack of exercise, though genetics also play a significant role. Gestational diabetes occurs during pregnancy and typically goes away after childbirth, but it increases the mother's risk of developing type 2 diabetes later on. Each form of diabetes requires a different approach to management. For type 1, insulin therapy is essential, while type 2 can often be managed with lifestyle changes and medications. Understanding the differences between these types is key to managing them effectively and supporting those who live with the condition. With this, we conclude the video. Check out our channel for more interesting videos for your health. Remember, our goal is to raise health awareness as much as possible, and you can help us do so by supporting us with your engagement. Don't forget to like, subscribe, and share to those you love to help them live a healthy life. This is Health Aware, and we hope we have helped you today in becoming more health aware.